My name's Kelly Clancy. I'm an occupational therapist and certified hand therapist and structural integrator. I own the Seattle Center for Structural Medicine in Seattle, Washington, and have been practicing in the rehabilitation field for about 26 years. I want to introduce you to the LIFT method, which is a brand new manual therapy method that has been developed over the course of the last couple years, and it has been something that has revolutionized the way that I am approaching and treating patients in my clinic setting. With the experience that I have as a structural integrator, I have combined the concepts of fascia and postural assessment, utilizing myofascial length testing in conjunction with ligament stimulation, and have found the combination to be profound in creating optimal results in aligning tissue and restoring function and reduction of pain symptoms. The advantages of the LIFT method are that we are able to target specifically where the body is having any kind of dysfunction, then apply a very light technique that is neuromuscular in nature, and we're able to release muscles and restore them back to their original resting length and strength, as well as restore the postural alignment and integrity of the structure, which increases function and reduces pain for the patient. So it's made my practice much more efficient and has allowed the client to be able to get back to their normal functioning at a much quicker rate. What I'd like to do is I'd like to show you some of the basic principles of the LIFT method and some of the concepts around the ligament-influenced fascial technique. So in our LIFT method training, what we incorporate is some objective measures both pre and post treatment to help determine where the connective tissue is restricted. We're able to use just a few common ligaments in the upper quadrant to release arm-related issues. So there are many structures in the body that we can affect via the LIFT method. And right now I am demonstrating a release for the sternocleidomastoid, and I'm stimulating the coracoacromial ligament and shortening the muscle. So when I'm engaging the LIFT method with a client, I'm able to target the particular tissue and also educate the client on how to isolate muscle functioning and muscle contraction, which acts as a neuromuscular re-education for the client and helps normalize movement patterns. Many of the fascial lines from Tom Meyer's work go to the bottom of the feet, and so what we have been discovering is by using our standard foot protocol with a massage tool, we are able to target the specific ligaments at the bottom of the feet and do pre and post testing for other parts of the body. And what we're finding is we're actually getting significant releases through the rest of the system by stimulating these small ligaments within the feet. As the technique evolves and Joanne and I continue to experiment with this technique, we're finding we're able to really hone in on the efficiency of the ligaments and the particular stimulation points, and being able to get global releases as well as specific releases within the tissue. So you can see that this technique is very, very efficient and doesn't take very long to implement. I can then do these releases, and then the second half of my session I could go ahead and take it into functional movement and therapeutic exercise. So very, very quick, I can do global treatment and then bring it into functional movement right away and send my patient home with a home exercise program that they can start using immediately. If you're interested in finding out more information about the LIFT method, you can go to liftmethod.com. We have course listings throughout the year that we're teaching both basic courses related to working on different quadrants of the body. So we have a course on the upper quadrant, the pelvis and the back, and the lower quadrant. We also have an applied advanced series that teaches more about postural assessment and testing through myofascial length, testing the fascial lines, followed by the implementation of the LIFT method. And that's a 7-part series. Each of our classes is 2 days in length and qualify for 16 CEUs, so we'd love to have you join us.